In this video, I'm going to walk through a patient that I treated in 2024 that's finished now, and she is a Class 2 Division 1 patient. I'm going to show you how did I treat it then, end to end, all the way to the final series of aligners. And then I'll show you how that would compare if we uploaded the case today using either the Global Clinical Preferences Align Default template or if we use the SMARTA template. So this is Kate. She is 10 years and 7 months. Her lower second molar on the lower right is not erupted yet, but she has a very significant Class 2, and she has already had trauma on the upper right one. So she's full cusp Class 2. There's a little bit of spacing in the upper arch, and she has a mild deep bite. So our conversation with the patient was growth modification, Class 2 correction, using Invisalign, elastics. And so this, in the next slide, I'm going to show you how she turned out. Now, this is Kate, and she is now 12 years, 4 months. It was a 20-month treatment time. She was treated with Invisalign, Class 2 elastics, and we treated her with one main series where the Class 2 correction was completed, an additional aligner where I titrated a little bit of the overcorrection from Class 2 elastics, and then a third finishing series of aligners. On the left is the initial ClinCheck plan that I got in the first initial setup. And this is back from April of 2024, before I'd really taken time to make my Invisalign personalized plan. And what you'll see later is that this setup right here is really close to what the Global Clinical Preferences default setup would look like. Over here on Treatment Plan 3, this is the case of what I actually approved. And one of the benefits of CBCT integration is that you can really see where the spaces are interproximally when someone has partially erupted teeth, when the gingiva is in the way, and you want to avoid root collisions or collisions as you're trying to align a rotated canine, when you want to avoid overclosure. So having that CBCT data is really helpful. Now, as we're starting to look at really noticeable differences, when we're retracting upper incisors, well, first off, I'm not sure that this case would be finished in 20 weeks. And so this case came back with 20 or 19 stages in the initial plan, and that's based off of tooth movement. So that tooth movements in each arch themselves, according to this first plan, didn't require that many stages, but we know we need at least maybe 6 months or 9 months of growth modification to get some significant Class 2 correction. Another thing that the software is not accounting for is the fact that as we are retracting these incisors, there's going to be mesialization force on the posterior segment, a tendency for these teeth to tip forward. And so for me, I really want to make sure that I have retention on the teeth that are in this segment in the middle here. Another thing you'll notice is that there's a precision cut but no attachment on a tooth that has pretty significant movement. So this is the plan that I got, and this is what I approved. So a couple things you'll notice here: a few more retention attachments, but not too different in final tooth position, other than I added a little bit more over treatment, but not much. And that's something that you'll notice later that I missed. So the other things that we'll notice is the two teeth are the different sizes. So that's going to be a decision I'm going to think about later with interproximal reduction or some composite on the number upper left central. This one has already had trauma, so there's a composite on there. That's why they're different sizes. And the other thing you'll notice is the number of stages. So I didn't ask them to slow down the movements. I asked them to do certain custom staging, but at the time I hadn't really fully evolved my deep bite staging pattern. I just said, hey, do this staging and then give me 32 stages. So this is how it turned out. Now let's take a look at what actually came back when that patient came in for an additional aligner scan. So we're going to look at treatment plan number 7, and we're going to put it up against what we had approved. And let's really take a look at that. So the patient was in this kind of open position where she had interferences on the incisors. She wasn't able to close down. She was in this kind of like odd overtreated place. And when you think about how the aligners were cut, is it possible that the second molar hyper-erupted because it wasn't included in the additional scan? That's absolutely a possibility, but this was her CR. And so what I did in this series was to undo some of the dental alveolar maybe compensations that had happened from really good skeletal growth along with some really good dental alveolar changes from a patient that wore her elastics a lot. So this is where I thought I would end up, and this is where I got. So I added some buccal root torque on the posterior segments. I intruded the lower incisors. I wanted everything to coordinate. Now, also notice there's no heavy red contact in the posterior on the initial order. And then on this one, I had some heavy contacts just because I really didn't know where her bite would jump to. I didn't know if it would rotate this way or auto-rotate. So all I changed in this set was a little bit of rotation on the posterior teeth, a little bit of deep bite intrusion, some class 3 elastics to undo a little bit of the extra modification that a growth that I hadn't accounted for. And then let's take a look and see how she turned out at the end of that series of aligners. So now we can close number 3, and we're going to take a look actually here. Let's look at number 10. Let's turn off compare, look at number 10 and compare it to number 7. And this is how, after wearing these like 12 stages to sort of titrate her over treatment, this is how she presented ready for her last series of aligners. So we are continuing to do some arch coordination, continuing to do some improving the interdigitation, elastic wear, no heavy posterior contacts planned. I have an interference there that might present a problem, something I may have missed, but I have a little bit of class 2 correction left, correcting the second molar that erupted, and then that was it. She was done after that set of aligners. So it was a year and 8 months, so 21 months for this patient's treatment. So next, let's take a look at what it would be like if we treated that patient today, whether we're using either GCP or a SMARTA template. So I asked the Align team to post this case again. If she were submitted today, how would it look with a just standard GCP Align default template? And what you'll see is there are those 19 stages. So it looks a lot like that initial ClinCheck plan that I got when I was first planning this case. And then I had to do those modifications and add attachments and customize my staging. So there are no retention attachments accounting for the equilibrium forces of anterior retraction. And there's no attachments on the lower incisors kind of guiding that intrusion. And then this is kind of how it ended up. So if we were to post SMARTA today, this is the first ClinCheck that would come back. Now we've got the retention attachments. They would already be built in. We wouldn't have to choose between an optimized attachment or precision cut. If both couldn't be fit, then the software would try to muster putting on a conventional attachment so that we wouldn't have a tooth that's rotating or distalizing that doesn't have an attachment on it. The other thing that you'll notice is that there is some over-treatment planned in this case. Notice how she's open right there. So the difference now between where this case ends and what I had approved in the initial order is that there is a little bit of over-treatment on the lower anterior segment. I think that would have helped. I think that would have helped with some of the interdigitation, lack of deep bite correction, that kind of thing in the first series. But one of the real things that we learned from this case that no template can help us with is if we don't scan that second molar or it's partially erupted and then it erupts during treatment on someone who is growing a lot, then we will create an open bite and get some side effects from teeth that weren't scanned in. So that would have helped. That would have happened regardless. But this attachment setup is very close to what I approved. And the other thing you'll notice is this has 30 active stages and 4 passive stages, 4 passive aligners, which are worn while the patient is waiting for their next set of aligners. So 30 stages of intrusion mechanics. And these are now my coded custom deep bite staging with alignment and then intrusion. And so without having to type that into the technician or artificially slow down movements, now I have optimized staging built into the plan, which is actually going to help because this is how long it's going to take for the class correction. So this is the SMARTA template, and right over here, let's go back and pull up again. Let's go take a look at the approved ClinCheck from 2024. Turn off these attachments. There we go. Let's zoom in there. So there is SMARTA, right? This is my approved case from 2024, and here is the SMARTA template. So it's pretty much spot on. The only difference is that now in final tooth position, I have a little bit more over treatment planned in the intrusion of the lower incisors. And then let's take a look at the other side. This is final tooth position of the approved ClinCheck, and this is final tooth position in the first ClinCheck that came back. So a couple things you'll see, I must have decided that I didn't want to rotate this premolar as much as the software was putting in. So let's take a look at that real quick. If I were working on this case, would I take away some of that rotation and replace this one with a retention attachment? Maybe. That would be a question of finishing, and I would just have to make that call based on CBCT integration and other factors. Did I feel like that rotation was appropriate, or was it overdone and I'd want to actually remove it? Those are the things that we take care of in that last 20%. So we're going to get more than 80% there on this case. More than 80% ready to approve. But then our doctor judgment, clinical judgment of how do we want this case finished and settled? How do we want the teeth to interdigitate? Do we want the rotations? Do we want mesiodistal root tip? Those kinds of things. All of that still needs to be done in 3D controls because that is your signature treatment plan. That is your customization for your unique patient. All right. So that's the same patient, the same software, but two starting points. As the SMARTA template was built, the question I asked on every case was, how close did each initial ClinCheck plan get to the plan that I actually wanted to approve? You saw the answer on this case. It's still my decision in 3D controls, and it always will be whether or not we're going to do a couple of customizations for rotations. But far more of this plan was already built in. So the SMARTA Comprehensive Template is at smartaorthosolutions.com. I'll see you on the next case.